Hey everybody, Dr. Dave Engelken here with Engelken Chiropractic and Acupuncture right here in Wichita, Kansas. Today we're going to show you what it's like to experience an adjustment in our office. We've got a special guest here, Stacy, who is a longtime patient and friend of ours. And like a lot of patients that come into our office, people are always on the go, they're stressed out, they're parents, they're working out. We've got all these demands being placed on our bodies and we need to figure out how to stay pain-free and be feeling our best every single day. So Stacy, I'm gonna have you lay face straight down on the table. Now just looking at somebody laying down on the table, there's a lot that you can see. After doing this for 16 years and thousands of patients, you can just see things right away in areas that I need to go to work on. So as we start up into the upper back, a lot of times we'll see patients that are driving, they're hunched up like this, maybe you're on a computer all day, or even from being on the cell phone, just all hunched up over like that, so that upper back gets extremely tight. A lot of these patients are also dealing with anxiety. So if that's you, I'm talking to you. So upper back here gets extremely tight. And then as we move down, the other area I like to look at is the ribs, right there where the bra strap goes. Sometimes you'll see one side of the rib is sticking up versus the other. The other thing we see as we move down into the lower part of the spine is the pelvis will be twisted or out of place, which in Stacy's case, her right side is kind of sticking out. And then as our pelvis is unlevel, we move down and then that's how you get leg lengths that aren't level. So we're going to show you guys what an upper back adjustment looks like first. When we're looking for things to adjust, what we're talking about is vertebrae that are twisted out of alignment, putting pressure on top of the nerve, and that's what creates dis-ease in our body. So let's take a look at this here. And we are just going to motion into her back, and we can feel right here she's got a spot that's stuck and not moving properly. Beautiful. That's exactly what we want to see right there. That vertebra moved right back into place, taking the pressure off the nerve. So the next one we're going to look at is as we move in here, that middle back, hers checks out good. And then when we come down right here, we've got another vertebra out of place. This is a very common area for a lot of people. Most of us are on the go, living life in the fast lane, drinking caffeine, all these different demands that we have to do. So the low back area right here starts to get pressure and stress on it. That's where our kidneys and adrenal glands are, and that's where we secrete cortisol for stress. So that's why a lot of people have this out. So we are going to clear that up. Perfect. That's what we like to see right there. So now we're going to move into the lower back. We can see that that right side's sticking up, so her pelvis is twisted, her feet aren't level. So we're going to straighten this out for her. All right, that's what we want to see right there. Now we're going to move into the neck adjustment. A lot of people think of chiropractic, they think of turning and twisting the head. In our office, we do a technique called specific prone. Prone means face down, specific means we're just adjusting the vertebra that needs adjusted. We're not just seeing how many bones we can move. So I'm going to show you guys what that looks like up here. So as we feel around in the neck, a lot of people that are out in the neck are going to have obviously neck pain, but they're also going to have migraines, headaches, sinus problems, all these different areas where they have issues at. So right here you can feel her neck is out of alignment. Boom, just like that, right back in place. So that's what an adjustment looks like in our office.